Hi, this is Kim Brown, publisher of the Horse Magazine. We're here at the 2008 AAEP convention, and we're talking to Dr. Sheila Schils with Equinew. How are you doing today, Dr. Schils?
Great, thank you.
Good. What we want to talk about a little bit is, can you tell us a little bit about Equinew?
Yes, our company, Equinew LLC, was established in 2005. It's a company that specializes in rehabilitation equipment for horse use.
That's great. And what kind of products do you offer with Equinew?
Well, the mainstay of our product line is functional electrical stim. And functional electrical stim is the gold standard of electric stimulation therapy for use in rehabilitation.
And what kind of horses can actually find some good from using this type of electrostimulation?
Well, the interesting thing about functional electrical stim is because it establishes a motor neuron response, that its use is applicable anytime that movement would be useful in rehabilitation. So the system is microprocess based. So you have a computerized system with hardware and software. When you open it up, it looks like a little computer inside. And the signal is so exacting that the horse actually feels like their own muscles are being moved. So you can get joint flexion, you get tendon and ligament responses when you use the functional electrical stim.
Dr. Schils, can you show us a little about your equipment and tell us a little bit about it?
Absolutely. This, as I said before, is a microprocess-based system. And when you turn the system on, you first of all see the battery charge at the bottom, and then the minutes are displayed at the top. You'll set your time, which is typically a 35-minute treatment plan for most uses. And then you hit the mode button. And once you hit the mode button, you'll see displayed at the bottom the voltage. And the voltage then is increased by turning the knob on the right-hand side of the unit. And as you increase the voltage, then the stimulation is increased to the horse. It increases by 0.2, so you have a lot of variability in the amount of stimulation that you're giving to the horse. So you can go up quite slowly, let the horse get used to the sensation. At the top are continuity values, and what these show is your conductivity between your electrode pairs. And there are actually, in the pads, there are 6 electrodes. The electrodes are underneath a removable and easily laundered liner. And these electrode pairs have a specific stimulation pattern. And this stimulation pattern has been established through years and years of research. And what occurs is there's one electrode pair that is diagonal, second electrode pair that's diagonal, and then the third crosses horizontally. This pad that is developed for the back will be placed along the top line of the horse with the center of the pad located right at the center of the spine. And this can be used from the withers all the way back to the gluteals. And when the signal is given again, you'll typically find 1 or 2 electrodes will start to contract, and then slowly all 6 electrodes will contract until you actually get such a deep stimulus that you cause a pelvic rotation if the pad is placed on the SI joint. For the leg pad, the configuration is similar. It again has 6 electrodes. They're once more housed under a removable and washable liner. And the leg pad can be used to stimulate either the extensor tendons or the flexor tendons, depending upon where you place it. Once again, the stimulation is increased to the point where you actually get a flexion either in the knee or at the hock. To cause a functional movement. And again, the use of this is so replicative of the natural movement of muscle, tendon, and ligament tissue that you can utilize at any time that movement would be useful. The system is extremely effective. It needs to be in qualified hands, so the system is only sold to licensed DVMs. In addition, we have offered it to licensed chiropractors with a DVM, or excuse me, with an equine practice, and licensed acupuncturists with an equine practice.
And tell me, what does a horse feel when you're doing an electrical stimulation treatment?
The horses respond excellent to the system. It feels like deep muscle movement to them, almost like a deep massage. The horses will, when they first feel it, kind of look a little puzzled because these muscles that are normally voluntary muscles are now starting to move, and then they start to feel the relaxation and they begin to drop their heads, chew, start to close their eyes. They really enjoy the treatment. So not only is it effective, but it's very easy for the horse to be compliant to.
Great. And Dr. Schils, where can people find some more information about this?
We have our website, equinew.com. They can also phone us at the office at 715-222-8279. And we really do pride ourselves with having excellent customer support. We are equine professionals. I have actually been a clinician for 15 years utilizing functional electrical stim in my rehab practice. And previous to that, I was a professor at the University of Wisconsin. So my PhD is in kinesiology and biomechanics. So we really do know rehabilitation, and we know what it takes to not only have a good product, but also to have the customer service so that product can be utilized effectively.
Great. Thank you very much to Dr. Schils and to Equinew. And we're coming to you from the 2008 AAEP convention.